I'd like to introduce Dr. Robert Copeland, who is professor and chairman at Howard University, Department of Ophthalmology. Thank you, Dr. Copeland, so much for coming to speak, to talk to our rising stars in our minority communities and to let them know a little bit about ophthalmology.
Thank you for having me, Chastity.
I'd like to just get a brief history about how you came into the field of ophthalmology.
Well, I always wanted to have a career in medicine. I was very fortunate to work as a high school student with a family practitioner around the corner from my house. And he really got me really interested into medicine. But it wasn't until I went to college. I went to Fisk University, and my first week being a freshman at Fisk University, I got hit in my right eye. From that, I had to be hospitalized over at Meharry for a couple of days, and that's when I found how important sight was. So I told myself if I was fortunate to get in medicine, that I would pursue a career in ophthalmology.
And how many years have you been in practice now?
I've been in practice since 1986, so that's about 27 years.
And how do you see that the field has changed since you were originally applying to today?
Well, there's been a very, very swift transition from, just look at cataract surgery. When I first came in, I was doing intercapsular cataract extractions, then I went to extracapsular cataract surgery. Now I'm doing phaco surgery, now we're getting into even smaller incision surgery. So there's been a rapid change just in cataract surgery and other fields. We have more diagnostic techniques to make surgery more successful, making diagnosis of patients' conditions.
So that sounds exciting because the career for ophthalmologists seems to be expanding exponentially.
Well, you're absolutely correct. I tell my kids, I have young children at home, I always tell them one thing. I said, my generation, we try to treat things. I believe as we go on with the rapid expansion and discovery that we'll actually be able to absolutely cure some of these conditions. So I think that there's been a rapid expansion in knowledge, techniques in ophthalmology. So just hold on tight, you'll see things change very rapidly.
Were there any challenges that you faced trying to get into ophthalmology?
I will tell you this, I've been very, very fortunate. I was able to get in ophthalmology. I love my residency program. I love the fellowships that I was able to get into, and I can't really say that I had any obstacles. I think people have been very, very pleasant to me, and also they've helped me along the way.
And I assume you had the best grades and the best test scores, or was that different?
Well, I was a good student, no doubt about it, but it takes more than just grades. They want to make sure that you are the complete package. They want to make sure that you have a human side. They want to make sure that you believe in patients, volunteerism, research. It's a whole spectrum of things that makes you very, very attractive. So hopefully I had some of those attributes, and that's the reason why they asked me to be an ophthalmology resident.
And what was your major in college?
I was a biology major.
Do you think it's important for the student today, considering a career in medicine, to have a science major, or do you think it's okay to have any type of major?
Well, I don't mind you having different majors, but you have to have certain science courses before you should think about a career in medicine.
My understanding is you've been at Howard several years and have had the opportunity to train many students of color as they have progressed along into ophthalmology, and I want to get a little perspective about your opinions in regards to increasing the numbers of minorities in ophthalmology.
Well, I think it's imperative that you have more minorities in any field of medicine, not just ophthalmology. If you just look at the dynamics, you look at the just United States population, you see that the minority population is expanding. So we had to have doctors that will meet their needs. And I always get this question, why should we have a program like Howard University? I'll tell you why you need to have a program like that. Because we serve those individuals. We go in those neighborhoods. We're the ones that are on the front line for those that have not access to certain things. So I think it's important, and no one knows you better than yourself. So when someone asks me why Howard, I ask why your program. So it's important. And we meet not just a niche that we take care of, but we're very, very important. We have our graduates all over the country, and they're in majority programs and on staff there, and also in other facilities around the country.
Now, I've heard some people argue that there is not an importance anymore for having historically black colleges and universities, and I wonder if you think that over time that the role of institutions like Howard or Meharry is going to decrease.
I don't think so. I think there's a bigger need. I went to historical black colleges for undergraduate. I went to a majority school for medical school. I did my internship, then I went back to a historical black college, Howard University, where I'm the chairman now. And is there a need? Yes, there's a big need. We only make up 1% of the ophthalmologists right now in the American Academy of Ophthalmology. Is there a need? I think there's a bigger need now that we train more people of color so they can meet the needs of the increasing population of people of color.
And why academia? A lot of people seem to be turned off by getting into the academic environment and want to go straight out of their residency programs into private practice because they think it's easier and more money. But why would you go into academic medicine?
Well, that's a very good question. I've always liked academics. When I did my first fellowship, I was asked to come back to be the program director. I was program director for about 3 years, and I left to go do another fellowship. And then when I came back, once again, I was the program director. And then our chairman left, and they did a search, and they decided on me. And I've been very fortunate ever since. I think academia is something that you have to have a passion for. I have a passion for training residents. But I'd like to tell you this, that not only is it writing papers, doing research, it's what you get back. When you train residents, what I get back from training residents is that they have made me a better physician. They've made me go to levels that if I have not had residents, I might not have attained. So training residents keeps you current. It makes your skill level very, very high, because if you're going to train someone, you got to be able to do it yourself. So why do I like academics? I think that it's in your blood. You either want to be an academic or you want to be in the private setting, or you can do both. What we're trying to train in our program right now is clinician scientists, so they can make a big difference.
And I just want to ask if you have any advice to give to those that may be listening to this website, either in middle school, high school, college, or in their residency programs. What kind of helpful information could you give them to help them as they consider a career in ophthalmology?
I have two things I would say to you. First, don't let anyone keep you from attaining your dream. And I want you to dream dreams and attain those dreams. That's what it's all about. So work very, very hard. And don't yield to temptation to do things that are easy. It's a straight course. You have to work very, very hard. You got to put your time in. And if you're fortunate, you have good mentors like I had, and they will help you along the way. If not, call me. I'll help you.
Thank you so much, Dr. Copeland, and I'm sure that some of these students that are listening will be eager to call you, because you obviously are very knowledgeable and quite a success story. So thank you so much.
Thanks for having me.